Okay, we're continuing from the book here, John McDougall, the Doctor Who Fought for You, written by me, Pete Rogers, and this is part 2 of the lecture on cancer by Dr. McDougall. So this is Dr. McDougall speaking. Even small cancers tend to shed a lot of cells into the blood. This is a very important point about cancer. A 1 gram tumor, just 1 gram of tumor, can shed over 1 million cancer cells into the blood in one day. It's the immune system that protects you from cancer. It's the immune system that has to remove these cells. Therefore, you want to protect your immune system. So here's the reference: quantitation of cell shedding into efferent blood from mammary adenocarcinoma. Okay? So think about it. The small tumor is shedding 1 million cancer cells into the blood every day. These are potentially metastatic cancers. They only become metastatic if they're able to successfully lodge in a distant location and grow in that location. So the immune system searches them out and removes them. This is what I meant by, excess dietary sodium is bad, because it'll activate the platelets and they'll cover the metastasizing cancer cells. The way they detect a cancer cell, it's like Braille. The immune system cells, they touch the cell and they feel the surface proteins, the surface glycoproteins, and they're either self or non-self or something, or DAMPs, damage-associated molecular patterns. Okay, so if they can't feel the metastasizing cell because it's covered in platelets, then the metastasizing cell can hide from the immune system. That's why that's bad. Also, excessive dietary fat will also activate platelets, so that's not good as well. Excessive psychological stress can activate platelets. That's not good. Okay, and the other point I want to make is one of the problems with chemotherapy is it suppresses the immune system. But we just talked about it. You need the immune system to remove the metastasizing cancer cells. So what the hope is with the chemo is you can wipe out the metastasizing cancer cells. But that's not always possible, nor is it always possible to wipe out the stem cells in the center of the tumor. To some extent, a little bit like the concept of an abscess. It's hard to successfully treat the cells in the middle of it. There's also the issue that some of these cancer stem cells grow really, really slow, and they might not be dividing at the time when the chemo's on board. The chemo can only be on board for a limited amount of time because it's got too many side effect toxicities. So if they're quiescent during that time when the chemo is administered, and then they don't start to grow till later, they can come back later, so to speak. Okay. This is Dr. McDougall speaking. He says, I had a doctor friend who was an oncologist. I asked him to show me one paper that indicates chemotherapy works well for solid tumors. He never could. So that's a big statement. This is Dr. McDougall saying that in his experience, his oncologist could not show him a single paper that said chemotherapy works well for solid tumors. Okay. Dr. McDougall continues. Dietary fat in general, and animal fat, saturated fat, and vegetables. Wait, hold on a sec. No, I don't know about that vegetables. I'm not sure how that got in there. Associated with prostate cancer risk. Foods that are high in the food chain are loaded with cancer-causing chemicals. Low-fat diets may be beneficial at any point in the course of prostate cancer. So I'm not sure how that word got in here. Here's the references. They're all listed here. Dr. McDougall, I am convinced that diet has a big effect on prostate cancer and that the SAD diet tends to make prostate cancer more aggressive. The American Cancer Society now recommends a plant-based diet for patients with cancer. Prudent diets are high in fruits, vegetables, unrefined grains, and they are low in meats, sweets, and dairy. That's coming from the American Cancer Society. Okay, let's scoot this over a little bit. And refined grains. Stop pouring gas on the fire. That sounds a little bit like Esselstyn, Don't add anything to the problem, all right? Cancer screening is overrated, and I do not recommend it. So this is Dr. McDougall talking. Cancer screening is overrated, and I do not recommend it. The only way to prove that a screening study is beneficial is to show in a randomized controlled trial that there is a reduction in mortality from that disease and in all-cause mortality. Estimated lifetime gain with cancer screening test, a meta-analysis of clinical trials, from JAMA, Journal of the American Medical Association. The findings of this meta-analysis suggest that the current evidence does not substantiate the claim that common cancer screening tests save lives by extending lifetime, except possibly for colorectal cancer screening with sigmoidoscopy. Okay, so these are big things I'm saying here. I hope this is registering with you. The cancer is constantly shedding cells into the blood with the potential to metastasize. The only way to remove those cells from your body is your immune system. One has to be careful with chemo because it wipes out the immune system. Okay? One should do everything they can to optimize immune function. High-fat diets suppress the immune system. That's why, and one of the reasons why they're bad for cancer patients. High-fat diets cause diabetes, which also suppresses the immune system. Another problem. High-fat diets increase insulin resistance, increase insulin-like growth factor, and increase mTOR, which promotes cell replication. So you see how things start going against you with the high-fat diets. And then the animal protein, we talked about that activating mTOR. Okay. I think we'll stop here for this. This will be the end of part 2. We'll cover the rest in the next session from this Dr. Mcdougall's lectures and writings on cancer.